The role of civil society organizations, CSOs, including community-based, non-governmental, and faith-based organizations in HIV and AIDS prevention, care, and support efforts is crucial in achieving epidemic control. Hello and welcome to another episode of The Last Mile with NACA. I am Adesu Alsi. There are at least two critical roles civil society organizations play globally and in specific country settings: advocacy and service delivery. This is The Last Mile with NACA. Keep watching.
The multi-sectoral approach to public health challenges facing Nigeria has been effective and successful in responding to the HIV and AIDS epidemic, with actors playing complementary roles in designing and implementing the national HIV and AIDS response. As the fight against HIV and AIDS approaches the last mile, the role of civil society organizations or CSOs in prevention, care and support efforts becomes even more crucial. Civil society organizations refers to a wide array of organizations, community groups, charitable organizations, faith-based organizations, professional associations, and foundations. Examples are the Network of People Living with HIV in Nigeria, NEF1, and AIDS Healthcare Foundation, AHF.
AHF is the world's largest provider of HIV care and services, and we have over 1.6 million clients on our watch and under our care across 43 countries in the world. And our mission is to ensure that we provide as an organization cutting-edge medicine and advocacy regardless of ability to pay.
Our major duty is to mobilize people living with HIV wherever they are, irrespective of their diversity, to form them into groups of persons living with HIV and encourage them to support one another in terms of treatment and also preventing HIV among positive, and to also protect their right in terms of ensuring that they are not being criminalized or discriminated against by the populace, and ensure that we advocate for policies and guidance.
Advocacy and service delivery categorize different roles played by various civil society organizations in the global or national HIV and AIDS response.
So civil society, they are more like a watchdog partners. The relationship between the civil society with government and other implementing partners is to always provide feedback about how services are being done, because the civil society, they are the ones from the community and they have all it takes to give feedback about how services can be provided in a more better way to people, because they have the better understanding about the situations in the community. So any interventions that does not have civil society will not really achieve the desired goal, because at the end of the day, civil society are part of the community, but interventions have a lifetime. If you are getting what I'm saying, to ensure ownership and sustainability, then the civil societies will continue to play that role and remind whoever that comes in line with what has been in place over the years.
The role of an implementing partner really is to ensure that the services get to those that need these services, and ensure that people come forward for testing, they get tested, those that are positive are placed on life-saving medication, awareness is created, and very importantly, is to ensure that there's community acceptance of the services that are rendered. Because if you don't have community acceptance, it's difficult for you to roll out whatever services you want to implement. And so an implementing partner is interested in ending the epidemic, in ensuring that now we are talking about the last mile, and want to go that last mile to end the epidemic. So all hands have to be on board to end the epidemic and ensure that the community is aware that we're almost there and we want to come forward to end that epidemic. So the implementing partners are working in close synergy with other strategic partners to end the epidemic.
The National Agency for the Control of AIDS, NACA, works closely with CSOs, providing prevention and treatment services, particularly among the most vulnerable and hard-to-reach populations.
Civil society, they have been working with NACA in terms of mobilizing the general public, in terms of campaign awareness, demand creation for HIV testing, condom messaging and programming, and designing of policies and programs that really improve the overall HIV response in the country. Like as I've said, civil society are key stakeholders or actors in the HIV interventions generally.
AHF has partners very closely with NACA with regards to testing and counseling services for Nigerians. We've also worked very closely with NACA for the International Condom Day, which is a yearly event we conduct in February, and we distribute condoms and create awareness on safe practices. And finally, I also want to mention the fact that we look at other areas, in fact, with regards to girls and young boys, and we distribute closely with NACA free sanitary pads to improve menstrual hygiene for young girls and women. So those are just a few of a wide range of activities that we work closely with NACA in.
Over the years, civil society has also helped to guide scientific research and has played a key role in challenging drug patents and bringing down the cost of AIDS medication.
Majorly, NACA is a coordinating entity, so they don't really involve into implementation, but rather they coordinate. So in most of the coordination, we are actually part of it. Recently, we conducted the stigma index survey. The DG NACA, he served as the chair of the steering committee.
Recently, we also did the condom culture polls, where we tried to investigate the condom culture of Nigerians and disseminate the results. And NACA was at the forefront of that, and we supported that process. In fact, there's even a follow-up study to show what the condom culture of Nigerians really is, and to educate Nigerians about the use of condoms and what the culture of condoms really is in Nigeria, to improve and to improve that, and to also reduce the prevalence of HIV in Nigeria. We've also worked closely to amplify with NACA to amplify domestic resource mobilization, and we've looked at a very interesting context, and I'm really happy to speak about this. We call it the Keep the Promise, and Keep the Promise is keep the promise to HIV/AIDS, and NACA has been at the forefront of this with AHF, ensuring that all the promises that are made towards HIV/AIDS are kept, with regards to keeping the promise with resource mobilization, with creating awareness, and making sure that whoever needs care and treatment for HIV/AIDS receives that.
The highly dynamic and ever-changing landscape of the HIV and AIDS epidemic poses several challenges to this stakeholder group.
The challenges that AHF faces, they are not peculiar to AHF. And I'm sure that many other organizations and entities who are on the HIV/AIDS space encounter these challenges. And one of the things that we have is the fact that many of the areas are hard to reach. And that is where we pride ourselves as AHF, that we go to places that are hard to reach to ensure that people receive HIV/AIDS care and treatment services. And this is, for us, is also an opportunity to make a clarion call for domestic resource mobilization and ensure that there's sustainability of the services that are going to be that are being provided for those that have HIV/AIDS, and to ensure that we cross that last mile. And for us to cross that last mile, there must be mobilization of resources.
Capacity building support especially for people living with HIV, there is need for that constant patient education and empowerment program. People need to be informed and aware of the services available for them to take, either is the treatment or prevention packages, and also how they can access these services. And again, coordination. As a network, we are having challenges in terms of coordinating our people. Sometimes you need resources to be able to pull people from different states to be able to know what are their challenges and need for you to be able to take a lead and present a fact sheet with evidence for advocacy. So that is critical, and we hope government is doing their best, but we will love to see more of that improved subsequently.
Civil society organizations are recognized as playing an exceptional role in the global HIV and AIDS response. However, there is a need for more synergy among CSOs to ensure proper implementation of policies and improve access to treatment.
We all know festive period is a time to loosen up. We all have fun, lots of hangouts.
However, statistics show increased indiscriminate sexual activities over the holiday period.
Unfortunately, this also means more people are getting sexually transmitted infections.
One gift I will never love to get during this festive season is that of HIV infection.
So, celebrate this holiday responsibly and with caution.
Avoid anything that can lead to new infections, impacting the progress made in the fight against HIV and AIDS.
Your New Year resolution should include knowing your HIV status.
Get tested for free today.
Bruv, babe, share love and not HIV infection.
This HIV test kit na ogbonge test kit wey WHO, Federal Ministry of Health and NACA don confirm. If you go like know more about the test kit, make you call NACA Information Center on top 6222 free of charge. Make you no eat, drink or use anything where they take clean mouth 30 minutes before the test. Or yeah, make you look for somewhere where be say na only you go dey there, we get better light and flat top. When you open the test kit, you go see paper where explain how you go take do the test. Read am well low so that you go fit understand them. You go still see test stand and another package where be say it gets test device, plus including test tube and something where be say them put am so that the package no go spoil. But you no go need that one for the test. Or yeah, open the tube, then put am on top the test stand. Now make you carry the test device, but make sure say you no touch the flat side. Or yeah, open your mouth, then rub the flat side of the test device one time on top your gum wey dey up and one time for the gum wey dey down. Now quick make you put the device inside the tube. Leave am there for 20 minutes before you read the result. Make you no read the result after 14 minutes. Now, if one line show on top letter C and letter T, then the test na positive and you go need to contact NACA for advice on wetin to do next. If only one line show on top letter C, then the test na negative. The test no follow at all if no line show or only one line show on top letter T or the background will be white before come change to red. You go need to do the test again. When you finish, pack everything where you take do the test, put for inside dustbin. Make we support NACA to fight HIV. Know your HIV status today.
Highlights of NACA's activities across the country and abroad is next in the update segment.
According to a UN report in 2020, Nigeria ranks number 1 in terms of new pediatric HIV infections with 21,000 cases, representing 14% of all new infections among children. The country also has the second highest number of tuberculosis deaths among children not on treatment after India. It is against this backdrop that the National Agency for the Control of AIDS, NACA, with support from UNAIDS and the US President's Emergency Plan for AIDS Relief, PEPFAR, organized a 3-day national consultation on pediatric HIV and tuberculosis recently in Abuja. The meeting had representatives of relevant government ministries, departments and agencies, development and implementing partners, and civil society organizations in attendance. Setting the tone for the gathering with her welcome remarks, the Director, Policy, Planning and Coordination, NACA, Dr. Olufunke Oki, stated that the objective of the event was to increase access and intensify commitment to scaling up diagnosis and treatment of pediatric HIV and TB in the country. Chief of Health, United Nations Children's Fund, UNICEF, Dr. Eduardo Salade, stated that the meeting was timely and pledged support to government efforts.
This meeting is very timely because it demonstrates the sense of urgency by the government of Nigeria to initiate a call to action and to mobilize the whole of government, key multi-stakeholders, private sector, academia, etc., including faith-based organizations, to eliminate pediatric TB and to end the AIDS epidemic among children. I pledge UNICEF and the whole of the UN Joint Team support for Nigeria to end the HIV and TB epidemic among children.
Some participants shared their opinions.
There is every reason why we need to prioritize children. Children, as we speak, with the HIV treatment program, coverage is just about 45% as compared to adults, which is over 90%. So children are being left behind. So this meeting is to see how we can ensure that children are brought to the front, coverages are increased, we reduce new infections by addressing issues about mother-to-child transmission of HIV, through which children get infected, and then also making sure that in terms of deaths, we mitigate deaths among children by first identifying those children who are infected out there, improve on diagnostics in terms of how we can identify children with HIV and also TB. So improving diagnostics and then also improving the whole issue around treatment, management of these children. What medications or formulations are children friendly, to make sure that at least when children are on those medications, they are virally suppressed and also cured of TB. So those are the things that is calling for this 3 days meeting.
As you're aware that UNICEF is an agency and we do care what happens to our children. So we're interested in looking at where the gaps are in both pediatric HIV and pediatric TB. In the last 2 to 3 years, we've worked closely with the NACA, National HIV and STD Control Program, to see how we can improve programming for HIV. We've had the acceleration plan, which we've supported them to develop. We've helped them to convey stakeholders around the acceleration plan to see how we can move it forward. So, as you said, we try to support the government to see how the established guidelines and policies and how we can push the implementation of those policies to have adequate coverage. We're hoping that TB is lagging a bit behind in the program implementation compared to pediatric HIV. We're hoping that the pediatric TB program also can be jump-started to make more progress so that there's more consultative meeting, convening of stakeholders around the pediatric TB program. So we hope as UNICEF to see the gaps, what the government needs, and to try and support based on our own mandate in UNICEF.
We want to be sure that looking at the next 3 years, we can smile and not come back here and be saying the same thing. For example, out of the estimated number of children living with HIV that should be detected, we are only finding about 45% of them. So we are not happy with that. We want to make sure we are able to find at least 95% of them. So, and but what we are doing well is that whenever we find them, we are able to place them on treatment. We are doing that very well. If you find a child, we place that child on treatment. So 100% we place them on treatment. So where we're not doing well is finding them. And our appeal is that mothers, caregivers should make sure they present their children for care. Deliver in hospitals. Don't deliver at home, because you will not know what that you yourself is carrying. Mothers should go through antenatal care, because most of the time the children are infected from their mothers.
With the development of the National Acceleration Plan for Pediatric and Adolescent HIV Treatment and Care 2020 to 2022, some gains have been made in the management of children and adolescents living with HIV, but much more needs to be done.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols, wear a face mask, and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria.
Sister! Where you dey rush dey go like this now? Take am easy now.
Na hospital I dey go to do HIV test.
Na everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o. During pregnancy or labor, or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sen ten ce. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as always, continue to support the HIV response. Do not stigmatize or discriminate against people living with HIV. Avoid and discriminate sex. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Adesu Elsie. Goodbye.